Hi, boys and girls.
All right. All right. So, hey, welcome to Culturally Prescribed. I am Robert.
And I'm Ben.
Joseph.
And today we're going to talk to you about an STI, or actually a couple, gonorrhea and chlamydia, and give a few pieces of information that you might find interesting. All right. So, guys, chlamydia, gonorrhea.
I'd rather have chlamydia because I don't have a reason. I don't know anything about comparing the two. They probably both suck. I don't know.
So why? So what are they? What is chlamydia? What is gonorrhea?
Well, they're both STDs. Gonorrhea sounds more exotic. Chlamydia seems really American and boring. I think one's the clap colloquially, but I don't remember which one. People tend to get that. They take antibiotics, but I think that's problematic eventually.
Yeah, well, I mean, taking too many antibiotics would be problematic, but you don't want to get either one, right? So, from what I remember about both of them is that when women get them, they can cause scarring in their fallopian tubes, and when you have scarring from multiple sexually transmitted infections, that can lead you to be more prone to ectopic pregnancies and have problems being able to carry a child to term, and that's not good, right? Like you don't want to have fertility issues with women because a lot of women want to have safe pregnancies. So that's one issue to try to prevent yourself from actually getting these infections, because even if you can cure it with an antibiotic, that there's still complications that arise from having multiple infections.
And it's one of those things, especially with pelvic inflammatory disease, where people just often don't even know that it's happening. And when we're talking about something that is so prevalent in our society, I think it's something that's really important to talk about, because a statistic showed that 1 in 20 individuals in America are carrying gonorrhea at any given time. And so, I mean, that's just pretty crazy to think. If you go have sex with someone, 5 people in your lifetime, your chances are, there's, I mean, it's not a huge chance, but it's pretty significant
that you can get either one. So is this just gonorrhea or chlamydia too?
Well, and then chlamydia is also kind of akin to gonorrhea in that it is very prevalent as well, upwards of 20%. So.
Oh wow, that's highly prevalent.
Yeah.
Oh, wow. So one thing I do remember from class is that if you do get gonorrhea, then they will treat you for chlamydia as well. And so they'll give you 2 drugs for that, right?
Yeah.
Just because you might have a co-infection, just in case, so you can prevent actually not diagnosing or catching an infection at some point. Yeah. So, I think that's interesting, right? Because they're so common, you just treat both of them when you see one of them.
And thankfully, it is something that is treatable. There's other STDs out there that exist, like HPV, which is something that is something that's more permanent. And that's why we've advanced a lot of programs like Pap smears, which has really benefited public health. And I think that's something that maybe gonorrhea and chlamydia don't really get that attention, because there's a level of stigma that exists there.
Yeah. Also, I think it'd be kind of less, I don't want to say less significant, but you can't die if you get chlamydia or gonorrhea, I don't think. But if you get HPV, you can get a cervical cancer, and then you're done. Yeah,
but I mean, let's say you do get untreated gonorrhea and chlamydia. We know that, particularly for women, that it can get into the internal part of your body, the peritoneal cavity, because there's an open access right past the ovaries where the bacteria can get in.
Is that the cul-de-sac? Or is that something else?
The pouch of Douglas? No, you're talking about where the fallopian tube connects with the ovary.
Exactly. Yes, right there, coming out from the apula and getting into the peritoneal cavity. And when you get that, then you'll have overgrowth of primary peritonitis, and that can cause problems in other areas, particularly like your colon. And if your colon gets inflamed and you have problems there, then that's a whole other host of bacterial issues that could come about. So not treating these infections can cause life-threatening secondary problems or diseases.
I also just wanted to add a point earlier when you were talking about pelvic inflammatory disease. You mentioned that it causes obviously a lot of harm to the child, and often those pregnancies are terminated. But also ectopic pregnancies are extremely dangerous for the woman as well, and can cause fallopian tubes to rupture, and in some cases cause internal bleeding.
These seem like they're pretty easily preventable as long as you're doing prenatal care, though, because if you get an ultrasound and you get obviously adnexal mass, and it's a fetus, that you can just yank it out. But that's if you're going to prenatal care. If you don't, that's a problem, and that happens sometimes.
I can see that being a problem, and it's not just for women too, right? Like, so guys can get gonorrhea and may not even know it because it can be asymptomatic, and they can transmit it from person to person, and that gonorrhea could then spread and cause like other disease problems. So actually just getting screened or just checking your your health if you're sexually active is really important, because
especially with this Tinder culture nowadays.
right. Everyone's trying to swipe right, and then just swiping right too. So just like keeping track of your health if you are sexually active is like really important. Because you don't want an infection just kind of going wild in your body if you don't have any symptoms of an infection, which is possible with either of these two bacteria. And they are bacteria, by the way. They're not viruses. Which is why we can treat them with antibiotics. Where the viruses don't work for antibiotics because
HPV has a vaccine, though.
Right. So that would be good because your body, once you get a vaccine, will use your immune system to take it out. Where the antibiotic is useful because it will actually directly attack the bacteria.
But anyways, it'll be interesting in our careers, at least, when we're going to see a lot of chlamydia and gonorrhea, I'm sure, as we progress throughout our careers as physicians. And so, like, kind of taking on the role of, destigmatizing, having an STD and getting the information from our patients so that we can, become aware of these problems, or at least help prevent them before they even take place.
So, what is the stigma with chlamydia and gonorrhea? Like, explain that.
Probably just being dirty, I'd imagine.
Well, just like it's something that is, I guess, like, because it is sexual in nature, and that's a good question. I'm like trying to think, like, because it affects your genitals, I feel like takes a different, role, I guess. I don't know.
Yeah, I think that anything dealing with your genitals, people consider it to be, like you said, dirty. You are not a good person if you have a complication because you are sexually active. And therefore, there is a moral judgment on you if you get these infections, right?
That was like with HIV in, like, I think the 80s or something. If you got it, people thought you were gay, even if you weren't gay. Anyone could get HIV, but at that point in time, it was like, oh, it's gay.
Right.
And once you have it, like, the idea of, like, not being able to have sex, or like that is something that is, like, if you have to, like, disclose that to a partner, like, that's a serious shame that probably exists.
Definitely. I think it is very important to make sure that that if you do get this type of infection, there are things you can do, but making sure that you do them and you are clear and communicate with your sexual partners is really important, because trying to ignore it or just like throw it under the rug, that doesn't help you or anyone else, and you're just going to have to deal with more problems down the line. So that's really important. And another thing, I do remember this from class, was if you are underage, right, you can get treatment for these infections without the need for consent from a parent or another adult. So you can keep that autonomy and that confidentiality from just for people you may not want them to know, and you can get treatment for that, and there's nothing wrong with that, and I think it's pretty good.
Yeah, and that's probably something that's not really like super understood by, kids who had their parents been taking them to the doctor's office, their whole life. And so that's kind of what they expect. So I feel like it's kind of on us to open up that space for that conversation and allow, our patients to express their concerns or be open with us.
Yeah.
Question though. So when you get a treatment for one of those, for example, it doesn't matter what STD or if you get an abortion or something, wouldn't the EOB for your parents' health insurance still get billed for something?
Well, first of all, what is EOB?
It's like I don't know how to explain it, because at the end of the month you get like a transcript of all the things you get billed for your insurance company.
It probably would show up on the bill, but it wouldn't show what it's for.
Yeah. But if you go to like Planned Parenthood, for example, and it showed up as Planned Parenthood, I don't think you could hide that.
Maybe not, but you don't have to go. I mean, you could just go to any physician, and even if it's not Planned Parenthood, and still get treated for these without having to disclose that to your guardians or your parents. Mm-hmm. So it's not just a Planned Parenthood access type of level of care. This is a national level of care that you, even as an adolescent, have the right to be treated with the proper drugs, even if your parents don't know or consent to it.
Yeah.
So I think that's cool.
Yeah, and it's something that's just very treatable too. I feel like there's a misunderstanding of I have this and now I'm stuck with it for the rest of my life.
Yeah,
but that's not really the case.
Yeah, not with gonorrhea and chlamydia.
With at least bacterial infections. We can treat those.
There are things you can do with that.
Yeah.
Yeah, great. Well, before we wrap up, is there anything you guys want to talk about these two bacteria that you think that people might want to know?
Use protection.
Yeah, the chlamydia vaccine, in 2019, they were doing a couple studies on it, so they might get that soon. Don't know.
Oh.
From the Google search, yeah.
Okay, cool.
Yeah, that's it.
Well, things might be actually exciting on the horizon. So with that, thank you for coming out to Closely Prescribed and talking about some interesting infections with these two. Please comment, like, and subscribe, and come back for the next episode. Might be some interesting stuff there.
Thanks.
Till next time.